Hello everyone, my name is Inemeset Sampson. I will be presenting case study number 9 today. I am a current student at UT Rio Grande Valley and I'm currently in the Psych Postmasters program. Objectives of this presentation is giving an overview of the case study, a summary of it, diagnosis, the rationale for diagnosis, the treatment, conclusion, and the references. The case study number 9 is about a 74-year-old man who has a history that's significant for hypercholesteremia, cardiovascular disease with a stent placement, and a possible TIA in the past. He presented to the clinic with his wife, who has been complaining of worsening memory problems over the years. Um, she's also complaining that he does have hallucinations with a non-restful sleep, waking in the middle of the night, appearing to be fighting in the middle of the night. And the family history that was given is that the patient's mother had a history of dementia. The medication that has been tried in the past for any of the symptoms that the wife was complaining about is a sleeping pill that was given to them by a friend. Now, the name of the sleeping pill was not given, but what the wife did say was that the sleeping pill made his situation worse, giving confusion to the point that he was almost taken to the hospital at some point. In order for us to make an appropriate diagnosis, we always have to do an assessment. So assessment in this case will be, getting the patient history, assessing for risk factors, family medical and psychiatric history, imaging to rule out other causes such as stroke. This imaging is either a CT scan of the head or an MRI brain with or without contrast. We can also use standardized tools of assessment to assess for cognitive impairment. One of the most common one used here in the United States is the mini mental state examination and also the MOCA test. These tests are used to assess for used to evaluate orientation, calculation, recall, and language. Laboratory testing is used to assess for electrolyte abnormalities, infections such as syphilis, kidney infection, like a UTI, because with elderly population, some of them when they have UTI, they get a little confused and things like that. After thorough review of the history of present illness and assessment, the diagnosis of the diagnosis will be dementia with Lewy body. Dementia with Lewy body is a neurodegenerative disease with the combination of Parkinsonian motor abnormalities and Alzheimer's form of decline. It's said to be the most common neurodegenerative dementia in the United States. About 1.4 million Americans are currently being affected, and research has demonstrated that the survival rate of individuals diagnosed is about 3 to 4 years after the initial onset of the disease. Not not the diagnosis, but the disease itself. This disease or disorder was found by a neurologist called Dr. Frederick Lewy, and hence the name dementia with Lewy bodies. And that is gotten from an article by Armstrong et al., and that article was published in 2019. What is the rationale for diagnosis? That rationale for diagnosis is dementia with Lewy bodies. The diagnosis is based on clinical presentation. In other words, the core features of the disease will help us in the diagnosis. The symptoms displayed by individuals with dementia with Lewy body are divided into three categories. One are the physical features, cognitive impairment, and behavioral health issues. Example of physical features are the shuffling gait, the tremors, the hunch posture. Example of cognitive impairment would be the memory loss. Behavioral health issues would be like hallucination, not sleeping really well, and in other words, violent dreams. Um, Of note, the diagnosis of dementia with Lewy body is made when cognitive impairment is preceded by Parkinsonian motor symptoms. All the above named symptoms were displayed by Mr. Estelle. On physical examination, he was found to have like a stoop posture, which is like a hunch posture. He was found to have tremors, and in some cases, we find that tremors are part of Parkinsonian symptoms. He was found to have cognitive impairment. And obviously, just from the history that the wife gave, he had worsening or decline, worsening memory issues, and his mother had dementia, so that's also a huge risk factor. Treatment wise, there's really no cure for dementia with Lewy bodies. Symptomatic treatment is recommended. Drugs targeted neurotransmitter are commonly used to treat the motor, behavior, and cognitive issues, respectively. Medication monitoring is very important, and the reason is that some of these patients do have bad reactions to the medications that have been prescribed in the past. So it's very important to monitor these patients and make sure that the medications that they are on are appropriate dosages. And it's also important to identify and treat the symptoms early in order to improve functionality. Examples of pharmacological treatment that I use, one of them is donepezil, which is the anti-cholinesterase inhibitors. It is known to be effective in the improvement of cognitive features such as orientation, recall, and repetition. Another example would be rivastigmine. It's using the same thing, used for the same thing rather, treatment of neuropsychiatric and cognitive symptoms. SSRIs, we use this in treating depression. Sometimes some of these patients will have depression, so it's also used for that, and also the preservation of cognitive function and hippocampal neurogenesis in these patients. Um, Namenda is a common drug that's also used. It's an NMDA receptor antagonist. It has proven benefit in regards to helping these clients to sleep. Levodopa is used in the treatment of Parkinsonian symptoms. Um, we can also use some clonazepam and melatonin, but be very careful, especially in the elderly population, to help with sleep as well. I would definitely go for the melatonin rather than clonazepam. Um, in conclusion, we know dementia with Lewy body is a progressive dementia, which is said to be the second most common type here in the US, affecting people age 65 and above. There's really no cure for it, as we discussed earlier, but it can be managed symptomatically. There are no disease-modifying drugs that are used in treating this disease or this disorder. What we got to do is just treat the symptoms as we see it. If it's sleep, if it's depression, if it's tremors, motor symptoms, cognitive impairment, we treat the symptoms as it is. Here are the references that were used in creating this PowerPoint. I do appreciate you guys, all you guys listening, and I wish everybody good luck in this class. Thank you for listening, and have a blessed day.